The gift of a curse, you live just to work. Your face on the shirt, no feelings to hurt. This shit ain't so bad.
Hello and welcome back to another episode of Let's Learn PT. I know it's been a minute, but we're back with another succinct lesson on some pathology similar to the slap tear and Bankart lesion video we have. This one's going to cover plantar fasciitis. Mainly, we're going to define plantar fasciitis, talk about the causes of plantar fasciitis, the related factors, and then finally how we treat it. As always, this is not direct medical advice. If you need medical advice or medical treatment, you should see a medical practitioner, but this is just for learning purposes and to help equip people with health knowledge and a degree of health literacy that they may not have had prior to this video. So, plantar fasciitis, what is it? It is inflammation and an inflammatory process of a ligament that connects the heel to the toes. So this is a good depiction of your plantar fascia. Your calf right here comes down and inserts on your heel. Your heel is where your plantar fascia originates and it inserts on your toes. So if I contract my calf, it's going to pull at this heel, and my plantar fascia is the connecting piece to my toes to allow my heel to rise up, to allow me to do running, calf raises, walking, anything where I am propelling forward off of my toes. It is a mechanic that involves my calf contracting and my plantar fascia allowing my foot to come up onto my toes and propel me forward. So we know we have that inflammation. Let's talk about where the pain presents so people can help detect if plantar fasciitis is really what they have going on. The pain location for plantar fasciitis is typically right in the heel. It's right on the bottom of the foot at the heel where our plantar fascia originates. Sometimes people can have a little bit of pain into the mid-substance of their plantar fascia, right in the middle of their foot, kind of a pulling pain there, but more commonly they're feeling a pulling sharp sensation in their heel. Some of the causes for plantar fasciitis are flat feet. This is kind of an elaborate concept in physical therapy, but if I have flat feet and my arch is falling in, my plantar fascia isn't working with a flat plane anymore. It's kind of bowstringed in, and it's working at a different mechanic than it usually is, and therefore that stresses the plantar fascia because each time I walk, I'm bowing it in and pushing off instead of just pushing off over a neutral level ankle. So that is one of the concepts that is a little bit more in depth, but flat feet is always something that's going to put you at a higher risk for developing plantar fasciitis. Repetitive trauma is another thing that's going to increase your risk quite a bit, especially if you're into a new exercise program, running more than you ever have in your life, working longer shifts that require longer hours of walking and moving around. Those kind of things are where we can see plantar fasciitis symptoms begin to peek their head around the corner. Tight calves would be another one, and if I have flat feet and I'm doing something repetitive that I have not yet got accustomed to, tight calves will develop. And once I have tight calves, it's only going to worsen the plantar fasciitis because my calf is constantly pulling on my heel, and the plantar fascia is that much more likely to get inflamed. Finally, poor footwear. Poor footwear, wearing flip-flops when you're doing a couple miles of walking, those kind of things where you are not wearing structured, proper footwear that supports your arch are things that are going to change the movement mechanic and the physics of how your plantar fascia is working, and the support of what you're usually wearing is gone, therefore increasing the likelihood of inflammation, pain, and the development of plantar fasciitis. Some related factors would be people who are running or playing basketball, volleyball, things where you're doing a bunch of jumping, cutting, and pushing off of your foot, requiring dynamic stability of your plantar fascia that it is not accustomed to being able to do. So people especially who are running 4 to 5 times a week, they're putting a lot of repetitive strain over their plantar fascia, and they are also tightening their calves, doing some things that are going to increase the likelihood of plantar fasciitis. Being overweight. Obviously, if I have more weight over my lower extremities, then that is going to ask more of my calves and of my plantar fascia and increase my likelihood of development of this pathology. Finally, manual labor, like I talked about earlier. If I'm working a long job at Amazon where I'm walking a couple hundred yards per hour on concrete, obviously I'm going to be at an increased risk of developing plantar fasciitis. Some of the treatment modalities that we use, the biggest one is rest. rest. If I have an inflammatory process that is causing my plantar fasciitis to spike up, I need to rest. I need to give my plantar fascia and my calf and my Achilles a break, subsequently stretch it so that I can help relieve that inflammation, relieve that tension, and see where my symptoms are after a period of rest. Soft tissue mobilization is typically something done by a healthcare provider, but soft tissue mobilization is designed at loosening up your calf and addressing some of the tightness and sparking the healing process for your tissue at the bottom of your foot, your plantar fascia. NSAIDs, especially early in the plantar fasciitis process, NSAIDs can be a modality we use to relieve inflammation and help with pain and help stop that inflammatory process before it gets too far down the train tracks. Orthotics is a big one. If I have flat feet or tall arches, I need something that's going to support my arch, make sure I'm in close as possible to a neutral ankle, and make sure that I'm not getting that bowstringing of the plantar fascia as my arch falls when I walk. Good support starts with good footwear, and if you need it because you have some kind of forefoot or rear foot anomaly, orthotics are the next step, which is a great thing that you can get from podiatrists. Calf stretching would be the final thing that we've talked about a little bit. Calf stretching is going to lengthen my calf, prevent it from pulling so much on my heel, and again, prevent so much tension and strain going through my plantar fasciitis, even at rest because of my tight calves. So this is kind of an overview of plantar fasciitis. I hope you guys enjoyed the video. Thank you guys for watching. See you guys next time.